good Palm Sunday morning here, April 5th, 2020, and welcome to the Open Line online stream. We are coming to you live on the Facebook page of WBLS. And joining me this morning, I am Fatiyn Muhammad, your host of the show, and our panel. Let's introduce our panel here. First up, one half of our Sports Brothers team is our in-house sports reporter, and that is our good brother, Bobby Childs. Good morning, Bobby. How are you this morning?
Good morning, everybody. It's great to be here again this Sunday. Hopefully everybody had a safe and secure week out there as the numbers of COVID-19 continue to go in the wrong direction.
That's right, but a direction that we expected, and we probably do have higher numbers if everyone was getting tested, but that's a conversation that we will have in a few. Also, the other half of the Sports Brothers team is the sports editor for the New York Amsterdam News, and that is our good brother, Jaime Harris. Good morning, brother Jaime. How are you?
Good morning, brothers, and good morning, family. And again, just want to extend thoughts and prayers, trying to stay in constant prayer for all those out there. So many people are suffering physically, mentally, emotionally. And so, I empathize and continue to pray for everyone and try to do my part.
All right. Your mic is going a little in and out, but I know you can fix that there because you got your Omega Sci-Fi hat on there, my brother. I can't throw the hooks up because I am not a member, and the brothers are not going to come looking for me. Joining us also is, I call him Brother Protest. That is our chairman of the People's Organization for Progress. He's also a candidate for New Jersey Senator. And that is our good brother Larry Hamm. Good morning, Larry. How are you?
Good morning, Fatiyn. Good morning to our audience. And I hope everybody are washing those hands. Wash those hands, so we can fight this coronavirus. I also want to mention that yesterday was the 52nd anniversary of the assassination of Dr. Martin Luther King. And I hope that maybe sometime during the show, we'll at least spend a minute remembering Dr. King and his contributions. And I want to give a shout out to all the frontline healthcare workers. My oldest daughter is a nurse, and I've been talking with her, and I've been talking with other nurses who are members of the People's Organization for Progress. And boy, are they putting themselves on the line because our hospitals are not providing them with adequate protective equipment. PPE, personal protective equipment.
There you go. We're going to definitely get into that. And also, before I introduce our guests, a lot of folks tend to forget this. They remember, rightfully so, April 4th being the assassination of Reverend Dr. Martin Luther King, but it's also the passing of former Congressman Adam Clayton Powell. He also passed on April 4th. And yes, brother, you talk about what's in your hand. And everybody knows Bob Slade always quoted Adam Clayton Powell, what's in your hand. So we'll have to make mention of brother Adam Clayton Powell. Our guest joining us from the borough of Brooklyn, my hometown, the borough where I was born, a lifetime Brooklyn resident who represents the 21st District, senatorial district of Brooklyn, and he chairs the Committee on Energy and Telecommunications, and he is my Prince Hall Masonic brother, and I'm talking about New York State Senator Kevin Parker. Good morning, Kevin. How are you?
Brother Fatiyn, good to see you this morning. Happy Palm Sunday to you and all the listeners, and glad to be part of this illustrious panel this morning.
Great. I want to start with you, Senator Parker. In your district and around the city, as Larry Hamm brought up, and then on our on air, we had two doctors on. And of course, we seeing on the news and hearing on in the media what is taking place in these hospitals. Can you tell us what it's like? What are your constituents are saying that workers in the hospitals being on the front line? As Larry said, a lot of these workers do not have the proper gear but they are risking their lives to save lives. What are you hearing?
Well, first, let me just, give acknowledgement to everybody who's lost people during this COVID-19 crisis. A lot of people, including myself, who have lost friends and family, and a lot of people struggling. And so we just want to remember them really quickly. And obviously the people out there who are struggling through COVID themselves right this moment, our thoughts and prayers are with you, and hopefully you'll have a speedy recovery. But also, as Brother Hamm indicated, we want to shout out all of our frontline workers, hospital workers, doctors, nurses, technicians, respiratory therapists. People don't mention that. We have all these ventilators out there, but there's respiratory therapists who have to work with them as well. People in our grocery stores, people driving us around with MTA and our rapid transit systems. We want to remember all of these folks. Our postal workers are still delivering stuff. People who, everybody ordering on Amazon, but, you have FedEx and UPS workers who are out here every single day. And so there's a lot of people still out here making it happen for us and making sure our cities and our states are open. And so we want to acknowledge them to begin with. This has absolutely been horrific, to be honest with you. And both from a community perspective and then also from perspective of what you're seeing in the hospitals. African-American communities in particular are the hardest hit by this coronavirus pandemic. We begin already at a place where we have more people with comorbidities and compromised immune systems, respiratory problems, asthma, and the like. And so when something comes in like this that affects everybody, when the world sneezes, the Black community catches pneumonia. And so that's the place that we're in right now. And so you're seeing a disproportionate number of both deaths and sickness. So the other thing too is that we are the disproportionate number of those healthcare workers, right? And then we have to go to work because we work for the MTA, right? In transit, we work, with the postal workers. We are these workers who are essential, who have to go to work every day. And then we're returning to more crowded and concentrated communities in most parts, particularly in New York City and places like Brooklyn, where I represent, than other parts of the city. And so our community is being quickly affected. And so, it is a very, and we weren't prepared for this. We just weren't, not on the national level, not on the state level. Certainly want to acknowledge the hard work and the leadership of my governor, Andrew Cuomo, who I think has done an amazing job. But we were all just behind the 8 ball on this. Nobody expected people were thinking about beds and equipment. Nobody thought about PPEs and masks. Nobody thought that we would run out this quickly. And so that's been the real battle. And people are stepping up. The mayor, the members of the Health and Hospitals Corporation here in New York City, the Greater New York Hospital Association, the members of 1199, PEF, CEA, all have stepped up to meet this crisis. And we continue to think of them and try to do the best we can to stand in the breach.
All right, there you go.
Let me just add, Fatiyn, and Senator, I echo that. My wife, she works for Montefiore Medical Center. She's been working from home for the past several years. They moved a lot of the staff who were working in the office to work remotely. So she's been blessed to have been having to do that for several years. But the stories that she's hearing from the nurses, from the doctors, from some of the other medical workers, it's alarming. It truly is alarming. I live in the North Bronx near Jacoby Hospital. And of course, the workers at Jacoby Hospital, sort of staged a protest and a demonstration, 2 weeks ago because of the lack of PPEs. In my zip code, 6.5 people out of every 1,000 that have been tested have tested positive. And so, and that's only the people who've been tested, as you said, Fatiyn, before we came on the air, and Brother Larry, there hasn't been widespread testing. So we know that there are so many people asymptomatic who are also carrying corona. And so, it truly is a crisis. It truly is alarming. And I just want to say, Senator, for brothers like you and people like you who are out there, who are advocating, who are working hard to ensure that those workers are receiving the necessary resources, brother, I commend you. Because it truly is battle.
Yes. Senator, I have a quick question for you, and then of course the team's going to jump in. It was first reported that the Javits Center and the Navy's boat out there in the Comfort, exactly, was going to be assisting those that were not affected by the COVID-19 virus. Now, then they changed it at the Javits Center. But it was reported as of yesterday that only 20 patients were on the boat, and that there was very strict restrictions of them of getting on that boat. There is a lot of folks that are sick out here that are not sick with COVID-19. Do you know what's going on with more patients being able to access this boat? For instance, my wife has sickle cell anemia. If she goes into sickle cell crisis, her hospital is Northwell out in Long Island. That hospital is full of coronavirus patients. She should not be in there due to the fact of her health. But the question is, where does she go? Does she, and I hear that you can't even go straight to the boat. You have to be taken there. So What are you hearing?
So that's a really good point. So we were happy from the federal government to get help, both converting the Javits Center into 2,500 hospital beds and getting the USNS Comfort from the Navy with 1,000 beds. And the ship is going to be used for non-corona patients, in part because the notion of obviously disinfecting a boat is extremely complicated. But honestly, you said that there's a lot of people here who are sick, not with COVID. Actually, we're seeing that number is actually down. The number of sick people, accidents, people are not out riding bikes, people are not driving cars. So there's actually a lot less accidents than, and a lot less sickness, frankly, than it had been prior. Everybody who gets sick, whether they think it's COVID related or not, should begin with a call to their primary physician. That's the first thing they should do. They shouldn't just run into, unless you have somebody having a heart attack or a stroke or something that's immediate, then you should always call 911 immediately. But if you're in crisis in some other way, you should always begin with a call to your doctor who can help direct you and help maneuver you through where it needs to go. And what's happening is that they're now taking most non-COVID patients to other facilities. And not in places, and so they've actually also designated some places as COVID hospitals, right? So like Elmhurst has become a COVID hospital. We're just now making Downstate Hospital a COVID, COVID hospital only. Kings County is essentially, they haven't an official designation, but Kings County is essentially not designated, but essentially a COVID only hospital. Brookdale has turned into essentially only a COVID only hospital. And so when you go to those emergency rooms, they are directing you and getting you into other places where you can get the proper care. Because what you don't want is, God forbid, your wife, to stay on your example, coming in with a sickle cell crisis and then contracting COVID while she's at the hospital because she's around so many people with the virus. And so that's why the instruction has been to reach out to, the best you can to your physician and deal with it that way. But almost every hospital has COVID patients, which is why it's been difficult to kind of maintain both with healthcare workers and with the general public.
Right. Well, we also see that it seems like the information that comes out changes, day to day, week to week. And what do I mean? And I'm not about going and living in the past. I see some of the media hits Mayor de Blasio here in the city about certain remarks made, and a lot of information 4 weeks ago was different than what we see now. But a lot of folks are saying that we should have been wearing masks. Everyone should have been wearing masks, not only people that were sick. Now the CDC has changed their protocol and recommend everyone should be wearing a cloth mask, not a mask like an N95, because you want to save those for folks that are on the front line. Yeah. So the question is, are we getting, and especially the lack of leadership coming from the White House, you know, who should we be listening to? I know the governor here in the state of New York, the governor in New Jersey is giving out daily information, and it seems like information that folks can utilize going forward. But the lack of leadership coming from the White House continues to hurt us. And when you have a president that says, hey, you know what, I'm not going to wear a mask, even though it was recommended, it's only a recommendation. You have other leaders, political leaders, like governors, that will follow that, and more people will get sick and die.
Mm-hmm.
That's
well,
why.
first of all, to answer your question directly, who you should listen to, that's easy. The open line. This is where the best information is coming from. And
Right.
so if you come here, you're going to get the best information.
Mm-hmm.
But beyond that, in terms of leadership, you know, what you're seeing is when you know better, you do better, right? And so even daily, we're getting more information out of Wuhan, China, and their example. We're getting a lot more information out of Italy and what their experiences are, and other places around the world who we're consulting with around how to address this issue. And you're right, initially, there was, you know, people were afraid because there was such a run on these N95 masks and surgical masks. We were afraid that we weren't going to have enough for, you know, for frontline workers, and so said, so done. And so here we are in that exact predicament. And so this week, you had a change in policy coming out of the World Health Organization and the CDC. And so, you know, we're now, you know, we know better. So now we're doing something different. But the biggest piece still is social distancing, and people must continue to stay home, stay socially distanced, but don't isolate yourself. You know, continue to reach out to your friends and your family, use your phone, text, video chat. Don't lock yourself off from the world. But we need to social distance, and we need to not congregating groups. Don't be outside like that, hanging with your boys on the corner and going to parties and all kinds of nonsense that I've been hearing is going on. We have to continue to socially distance in order to effectively, one, not continue to spread the virus, but then also to make sure that we don't continue to overwhelm our healthcare system as bad as it is. Now, your every point around the lack of leadership from the White House is 100% true. In this crisis, honestly, we don't have the luxury of sitting around and just criticizing the president. And we just got to figure out what we have to do, which is why you've seen, Governor Cuomo step up, why you've seen the mayor step up. Really want to thank the work of the mayor as well, and my good friend Emma Wolf, who's now the deputy mayor for administration, who's kind of the COVID czar for the city, and has really been coordinating, making sure that resources are getting to our hospitals. I'm having daily calls with almost every hospital in Brooklyn, and almost all of them are getting what they need. A little bit slowly but surely. But we're dealing with a crisis in which we've been behind every step of the way. And so yesterday was a couple of big announcements from the governor, getting 1,000 ventilators from China, and we're getting 140 from the state of Oregon. Correct. And they're greatly appreciated. And
1 million face masks also came from China.
Yes. Yeah. So we're fighting a good fight, and hopefully, the notion of what we have to do around this will hopefully in the next week or so, when we expect to hit our peak numbers, will be what we need to be, and hopefully the peak won't be as high as we think it is.
Larry?
I just want to add that I think it's very important. First of all, I want to say I agree with everything that Senator Parker said, but we need to listen to our government leaders. We need to listen to the governors and to our mayors, because they are giving us, for the most part, good advice in terms of how do we fight against the virus itself. But I think also that we should put foremost in our minds, excuse me, those medical experts. We need to listen to what the medical experts are saying, and people out of the World Health Organization, the CDC to a degree, but the CDC is controlled by Trump. Trump is a malignancy that we have to get rid of. In fact, what the Trump administration has been doing with regard to this crisis is a crime against humanity. It's not just that he's mismanaged the situation. He is giving out, and members of his administration have been giving out information that in effect has led to the deaths of people. They have implemented policies that have hamstrung our health institutions so that they cannot adequately serve the people who need to be served. The unfortunate part about it is that the Republicans are in control of the Senate. So we really can't remove Trump before November, but we should be doing everything we can right now to make sure that happens. With massive voter registration, we can do online voter registration and so on and so forth, but we must get rid of the Trump administration. I also want to thank the senator for giving a shout out to the postal workers. As a former postal worker myself, I can sympathize with the plight of postal workers. And right now, some of the Congress, you know, the federal post office is the only business that's mandated by the Constitution of the United States. The Constitution requires that we have a postal service, and our postal workers are on the front line. And like our nurses, they don't have adequate PPEs, personal protective equipment. And that's outrageous because they work for the government. It's not like they work for some private corporation. They work for the government who's supposed to be leading this fight. So I wanted to say, number one, our congressional leaders need to look into what's happening to our postal workers. Number two, they need to get their PPE. Number three, all these frontline workers should be receiving hazard pay in addition to their regular pay, because they're putting their lives on the line. When these people go to work, it's almost like they're walking into the valley of the shadow of death. You know, and it's outrageous that we are in the richest. I mean, look at how the situation has changed. We, the United States, the great democracy, we're begging China to send us some fucking 75-cent face mask, some 75-cent face mask. We don't make nothing in this country anymore. We don't even make the damn face mask. So this crisis has not just to do with the Trump administration, it has to do with the ramshackle, privately held healthcare system that's tied to employers. And you know who we should listen to? We should listen to people who say we need a Medicare for all healthcare, universal healthcare system in the United States. And leaders who are not saying that are betraying the people.
Well said, Larry. So listen, I know you're sitting outside 7-Eleven. You may want to keep it down so the cops don't knock on your window out there, right?
There you go, baby. Woo, I'm telling you, boy. He was hyped this morning.
No, you know what? You know why I'm so passionate? My daughter is a healthcare worker. I mean, this stuff is coming home to me. You know, I pray that every day, my daughter works in 2 hospitals, that she won't get the virus. This virus is killing the healthcare work. It's killing them. They are being infected and they are dying. And everybody is walking around like everything is okay. Where we're in the the house is on fire.
Yes.
And we need to put the fire out.
Absolutely. You know, so Fatiyn, you know, the president has tried to claim that he is a wartime president and that this is a war that we're fighting.
Right.
So for to believe that, you would see different type of behavior. So for example, in wartime, if one of your lines of defense gets overrun, you would do whatever you can to fortify that line. And what's the expression? Hold the line.
Right.
Well, the line that is being overrun is our healthcare system. And what did we hear this week? That the stockpiles are not for the states, that, you know, they're asking for too much stuff, maybe they're selling it out the back door. So that's not leadership. So when you ask the question, who should we be listening to? The easy answer is who we should not be listening to, which is him, his son-in-law, who for some reason now has mucked up things even more, because he is throwing out ideas to try to cut through bureaucracy, and all he's doing is taking valuable time away from those who know what they're doing. He put Peter Navarro in for these complicated supply chains, and just because he's a professor who wrote a book about China and he's anti-China, he fails to recognize that supply chains are global. And in order for you to do things, you need to rely on other countries. And because Trump was so late and still hasn't really evoked the Defense Act the way he should, because you need that to get different supplies to it. He ripped and railed against GE and GM and Ford, and they were trying to build these ventilators. But the problem was they couldn't get the parts. And why couldn't they get the parts? Because there's profiteering going on. Because they needed him to pass some laws to actually say, give the supplies to them so they can build these complicated machines. So I could tell you who not to listen to, and I can tell you who I spend more time listening to. I listen to the medical experts, not the CDC, because they're kind of late with stuff, but who the World Health Organization has been on top of this from day one, but they're an advisory group that doesn't always get the respect, and countries, as we talked about before, don't always share the truth in a timely way with them.
And 3M, Bobby, is now Trump's latest target. And to go back to what Senator Parker and Larry stated, you know, we certainly want to listen to our medical experts, but Governor Murphy and Governor Cuomo have done an exemplary job, extraordinary, in listening to the medical experts and taking that information and using that information to make decisions, not decisions that are based on political expediency, but saving lives. And so Governor Cuomo and Governor Murphy have to be lauded for what they've done. Now you juxtapose that with Governor DeSantis in Florida and Governor Kemp in Georgia, and they are essentially costing lives. I mean, the decisions that Governor DeSantis made are just, it's dumbfounding. And as Larry said, it's criminal, it's inhumane. And the same thing with Governor Kemp, who is in Georgia where the CDC is based, and claimed he didn't know some of the protocols and how corona was being spread. I mean, that is a flat out lie. What he's doing is they're trying to be in lockstep with Donald Trump because they're acolytes of Trump, and lives don't matter. This is all about maintaining Trump's power, his position, and hopefully his reelection. I'm not saying hopefully, they're hoping, you know, in November, and it's costing people their lives. And so we do have to listen to our political leaders. We have to listen to those who are truly leading, which is Governor Murphy, which is Governor Cuomo, and the mayors. You know, de Blasio, as Fatiyn said, you know, we've, you know, certainly had our back and forths, but he has stepped up, and now he is trying to do what is right. He's understanding that the decisions that he is making, some of the decisions that he's made were in error, and so he's correcting those. And Brother Baraka in Newark, who said, and Larry and I were talking this off the air, he made a very profound point. He said if the federal government, if the Trump administration is asking cities and states to bid on ventilators, he said Newark cannot compete with New York City. As Brother Baraka said, we bid $7, for instance, they bid $9 for a mask, then, you know, we can't compete with this. So this leadership has to begin at the federal level, and there's been a complete lack of leadership. And to your point, Bobby, you know, you mentioned Kushner. They changed the Health and Human Services website to align with the nonsense that Kushner said this week about the stockpiles. He should never be allowed to speak to the American public again on this topic.
Right.
We talked about Kent. You know, one other thing to add on to what Kent did. So he made that ridiculous statement, as you pointed out, that he didn't know the severity of it, whatever nonsense that was. And then he put a stay order, some type of stay order, where many of the local mayors and county heads had actually put it in. So you know what he did this weekend? He actually reopened the beaches in Georgia.
Yes.
Opened them.
Yes.
And his explanation is, well, you know, people need to go have a place for exercise. So he opened the beaches, which undercut the closures that the local politicians put in place. It's just mind-boggling that
DeSantis excluded religious services. So in essence, he's pandering to the evangelical base when he did that. That's all he was doing, was pandering to the evangelical base. And if you have 500, 200, 1,000 people at services, they're going to spread this virus throughout the community. And so this is all for political expediency. This is not taking lives into account first and foremost.
So let's talk about that. Let's talk about that real quick. Sorry, excuse me. So you're talking about last week we heard that a minister in Florida held a church service, and he was arrested for that. As you just mentioned about how now that in Florida they have they excluded the churches in the sense of their gatherings. Reverend Sharpton this week, along with his National Action Network group of ministers, made calls to discourage some ministers that feel that this Palm Sunday and Easter Sunday, one of the most holiest times for the Christian church, that they should hold service in person. And how do we flatten this curve if we have one set of rules for this state and another set of rules for another state? And then you have the president that just said over the weekend, hey, you know what? We may face our worst week this week, but then wants to loosen the sanctions in the sense of social or public distancing, dealing with Easter Sunday with the churches. How do we deal with this?
Well, I just want to make this quick statement and let the brothers answer that question. Yesterday, again, Reverend Sharpton implored ministers not to hold services and encourage people to take part in services where they are going to be in a very dense area. He said, let's do these services. My mother's having service over the phone. Many people are having services and doing, prayer over the phone or via Zoom as we're doing. And so Reverend Sharpton, again, yesterday implored ministers to please reach out to their congregation and inform them.
I just wanted to add that, first of all, I want to commend those ministers that are following the guidelines. In fact, I think the majority of the religious leaders are following the guidelines. I mean, even the Pope is the head of the largest Christian religious institution in the world. And the Pope has said they can do it, in other ways. So if the Pope can do that, everybody else should be able to do it with their particular denominations. What we see here is the undue influence of these right-wing evangelical groups and governors bowing to them, particularly there in Florida, Trump bowing to them, and it just goes to show, and we've had similar situations with other religious groups about vaccines. There was a recent crisis in New York where certain religious groups wanted to be exempt from vaccines when all kinds of illnesses were breaking out in schools. People have to understand the separation between church and state. That's one of the pillars upon which this country was founded. And there's a lot that I disagree with the founding of this country, the genocide against the Native Americans and the enslavement of Africans. But one of the things I do agree with is the separation of church and state. And when this government says we have a plague, a crisis, and we all need to pull together, then the churches should join with and cooperate with everybody in fighting against that plague.
So, Brother Fatiyn, let me just say that I think you make the 100% of the right point. On a national level, without proper national leadership, you have an incongruity going on between certain states like New York, New Jersey, Connecticut, right, that have these stay-at-home orders, and then other places that have decided not to do it. The example I heard that's kind of apropos is like having a peeing section of the pool, right? It's just not going to just affect that part of the pool. It's going to affect everywhere. And so, it's really somewhat asinine for the president not to step up, not to have more national leadership, and not to have everybody kind of following the same rules, particularly when the person, Dr. Fauci, that you put in charge is telling you one thing, and then in direct contravention, of what the doctor who you put in charge is saying, you're going to make a different set of orders. It's been a circus. It's been nothing less than a circus. And it would be entertaining if people's lives weren't literally at stake. And unfortunately, the states and the municipalities oftentimes are on their own. And so, God help us all, and God help the people of America.
What do we say about a president?
He's not wearing a mask. He's not disarming the people. He's misleading the people.
That's correct.
He's telling people, hey, it's okay. I'm not wearing a mask. So again, you have millions of his followers who are going to say, well, hey, he's not wearing it. We're not wearing it. And again, he presents himself as trying to disarm the people, when really what he's trying to do is he's minimizing the severity of the spread simply for his own personal interest.
Right.
Agreed.
What do we say about a president who finds the possible death of 200,000 of his fellow citizens an acceptable loss? Trump just said that this week, that he's doing a good job if 200,000 people die. There are cities that don't have 200,000 people in them. We got to get rid of the malignant Trump administration.
So just remember, he started off saying we started with 15 and we'll have less than 15. So like I said, I disregard everything. Fatiyn, as you were talking about the mask, right? A couple of things, right? So one, this bidding that's going on state to state. So I'm always calling out how sadly ironic things are. So we pay taxes to the federal government. The federal government uses some of that money to put stuff in a stockpile. They also use it to help commence trade that goes back and forth. So now we also pay local taxes, and those local taxes help the cities and states that we're in purchase things as well. So the American public has paid twice in taxes, federally and locally, to get supplies that the federal government is buying. And what did we learn this week at the press conference when that military man made the statement 200,000 PPE or masks were going to New York? And then when pressed, you learn they're not going directly to the hospital. They're going to a third party who does what? Sells it to the highest bidder. So I don't quite understand how that's supposed to work. We pay taxes for these services. The services go to the highest bidder. We don't get any money from it, but you just end up paying more taxes, and you don't get the materials that you actually your taxes went for. So that's one thing. The other point is, back in 2015, there was a U.S.-based company, O&M, so Owens & Minor, and they're in the healthcare profession, and they do a lot of the PPE. They actually put forth a proposal to the Obama administration to create these reusable N95 masks. And they had a prototype, and they went and they got a little bit of funding to improve the prototype. And because things don't move fast in the government, in 2018, under Trump's administration, it was presented to him and said, well, listen, it works. They just need more investment money, and then they can put this in full production. And take a guess what happened? Nothing. There was no money allocated, and the O&M just walked away from it and said, it could work. We know it could work, but it wasn't important to the Trump administration at that point in time.
Bobby, that military officer that you mentioned, something that we spoke about this past week, and both you and I were flabbergasted when he said he doesn't want to disrupt the supply chain. Well, disrupting the supply chain is exactly what needs to happen, because as Governor Cuomo aptly said, what needs to take place is the cities that are having, New York, Detroit, cities here in the Northeast who are New Orleans, who are having the surge, that's where the equipment needs to go. Once that curve begins to dip, then that equipment will go to the next city that's experiencing the surge. That is very simple. That is not complicated. That is not complex. But Trump has turned this into a capitalistic exercise by warning cities and states to bid on the equipment. And again, just like he did when he came in, he tried to dismantle institutions within the government. He is trying to create chaos within this system. For whatever reason, I really can't say, I don't know. But again, we know people are dying, and we opened up talking about the frontline workers, Larry, your daughter, Senator Parker, people you are representing in your district who are dying because Trump has turned this into an exercise in capitalism, when right now what we need is a collective effort by all states and cities to ensure that equipment is provided, and it can be done.
And I just want to commend, speaking of military officers, I just want to commend Commander Crozier of the USS Roosevelt, who was the commander of that ship, and they had a COVID-19 outbreak on that ship, and he was trying to get aid for his men. He was trying to get the boat docked so that they could get aid, and they wouldn't give it to him, and he spoke out against it. And what did he get for speaking out for the health and safety of his men? He got bagged by the Trump administration.
Right.
They don't want any. I wish we had generals that had the same integrity of Commander Crozier. Now, I'm going to tell you, I didn't serve in the military, and I don't, I'm very critical of U.S. military adventures abroad. But when they fired Crozier, I felt some kind of way. And I think I'm calling on all of our viewers and listeners to call their Congress people and tell them they must not fire that man. He spoke out for the health and safety of the men on his ship. He did what a good commander is supposed to do. He should be restored to his position, and he should be made whole for anything they tried to take away from him, because he did the right thing. The other thing I want to say about Governor Cuomo, who I think is doing somewhat of a good job in terms of informing people, but I want to understand, why does Governor Cuomo want to cut back Medicaid? We need Medicaid funds.
He cut
in
it.
New York
He cut
City.
Medicaid.
Yes. Why? I don't understand that. How can we be cutting back funds for medical care when we're in the midst of a pandemic? And the last thing I want to say on this, if there are any hospitals right now that are in financial distress, we should identify those hospitals and call on the federal government to give them aid to keep them from closing. Just this morning, there was an article in the North Jersey News, which has papers like the Bergen Record and the Herald News in North Jersey. And they were talking about one of the reasons we can't adequately respond to this crisis is because of all the hospitals we close. Why are we closing hospitals? We need to federalize the hospitals in the United States. We need to federalize the supply chains that provide the equipment and the medicine that we need. Trump needs to implement the Defense Production Act. He has the power, but he won't use it because he would have to push his friends to do things that they don't want to do.
Let's take a look at this here for a moment, because I just think that we're headed down a dark road, and I'm telling you, I just don't see the outcome being good if this pandemic lasts through the summer. And what do I mean? As you mentioned, Larry, dealing with Commander Crozier, dealing with him speaking out for those folks on the ship. You got the Amazon worker, I believe in Brooklyn, that spoke up and was fired, and it was found out that the company was going to slander him. My daughter works for an essential company, and I will not put that company out there due to the fact that it's my daughter at this particular time. But at least I'm glad that she takes something from her father, because when she found out that there was a coronavirus person working there in the building, and then By speaking up, she found out that it was on her floor. And by speaking up, she finally got a cleaning. But as we start to see these companies that need these workers and more workers start to get sick. Yesterday, you saw on the media, nurses were speaking up that they're not getting the support. Where are we headed as a country? Because we know that this 1,200 bailout, we're going to need more. Where is all this money coming from? People are losing their jobs and bills need to be paid. Where are we headed? And I know, Senator Parker, you're the political person here. I think we're headed down a dark road that not only this economy, globally, this globally, we may fall. And we may fall definitely as a nation. What is your thoughts?
Let's be clear that the pandemic that we're dealing with and the economic tsunami that's heading towards us is a global phenomenon. It is not just the United States. We may be a little bit in a bubble, but everybody's having the same issues, both economically and as it relates to, deaths and so forth. That being said let me address 2 points. One, that the state of New York, for instance, was in a $6.5 billion deficit prior to COVID-19 hitting us as hard as it has. We just passed our budget last week, is about $180 billion. And we expect somewhere between a $10 and $12 billion deficit coming up for that. And we're not going to make it without a federal intervention and federal bailout of the state. And we're not alone. It's not just New York. When we look at all 50 states, almost all of them are in several tens of billions of dollars worth of deficit. When we looked at what we did around the MRT, what we call the Medicaid redesign team, is a process in which we try to find efficiencies. And so I know people are describing them, and the narrative was around cuts. There were efficiencies that needed to be found, and there's Medicaid reimbursements that you can get around those efficiencies. And so it's not as clean cut as cutting Medicaid. There were efficiencies that need to be found around the program. Now, are there a lot of problems with Medicaid? Absolutely. The disproportionate amount or the amount of reimbursement that goes to large hospitals in white communities versus what happens in central Brooklyn communities is absolutely one of the things that we're working on. But I think by and large, we're in a place where the hospitals are getting, finally, what they've needed. And let me just applaud the governor's ingenuity by working on things like, not waiting for the federal government, doing research on different kinds of treatment and modalities to get people, up and going. Approving splitters on
the ventilators.
On the ventilators. Approving CPAP machines and other kinds of machines to be used as ventilators. And then again, they're not going to do the exact same job, but it's going to get us to a place. And so I think that we're pulling out all the stops in the state of New York to make sure that we battle COVID-19 and make sure that coronavirus does not take us out. Just so you know, there's been already 2 federal bills passed. The state of New York, and I can't speak unfortunately to Jersey, but the state of New York is going to get about $11.3 billion from that, $5 billion in a lump sum that's going to be used for COVID-19 direct related expenses. There's about $4 billion going to the MTA and other mass transit around the state of New York. And then there is $1 billion coming to the city of New York and $1 billion going to other directly to some counties. And in addition to that, we in the state of New York put $40 million just for COVID in the very beginning, along with giving the governor some emergency powers, and which allowed him to make some moves without having to come back to the state legislature. But both we in the state legislature in New York, as well as the Congress, put more money into unemployment insurance and expedited the process so that more people can get more relief faster. And then there's also about $30 billion nationally for small businesses. And so if you run a small business, you need to go to the SBA website and get that info so you know how to apply for loans and grants that are available. And Brother Greg Bishop, who is our commissioner of the New York City Department of Small Business Services, has a set of relief measures and loans that you can access on SBS's website. That's www.sbs.ny.gov. And sorry, nyc.gov. That's www.sbs.nyc.gov. But we have here in the state of New York a helpline. I want to give people the helpline. If you need anything, 888-364-3065. Again,
say that one more time. Say that.
888-364-3065. And that's a 24-hour a day staffed helpline where you can get information about statistics, where you can get frequently asked questions, we can get understanding about the symptoms and about some of the treatments that are available. And we also have a website at www.coronavirus.health.ny.gov. Again, that's www.coronavirus.health.ny.gov. And so we have lots of information out there. We want to have facts over fear. There's a lot of fear going on in our community. A lot of the fear is based on conspiracy theories. And I don't like to call them conspiracy theories because, as I always say, Fatiyn, it's not, you're not paranoid if they're really after you. And certainly the history of African-American people in this country shows that they really are after us. And so, but there is like real information out there that we should be holding on to. I know there's a lot of conversations about testing. We are in the state of New York are doing more testing per person than any other place literally in the world. Is it enough testing? Probably not. But what people should really understand is that testing isn't related to treatment necessarily, right? And so, them knowing that you had COVID-19 doesn't mean that there's some secret treatment or something they give you a shot and you're good. The reality is that this is a virus, and really what only thing they're treating in the hospital is the ancillary things that are happening to you, sometimes developing infections and oftentimes not having the ability to breathe. People are being dehydrated. So everybody out there, if you're COVID positive or not, should be doing things to work on your own immune system. You should be resting. You should be eating healthy. Whatever vitamins you take. I'm a big person on vitamin C and zinc, and I've been doing garlic water every day, my ginger tea every day. But getting rest, eating healthily, getting some exercise every day I think is important in terms of both our physical health, but also and we have a long way to go. There's going to be at least another month or two in which we're going to be engaged in social isolation, and we're going to need to lean on each other. We're going to get through this. We're the people who were here the day before yesterday, and we're going to be the people who are going to be here the day after tomorrow. But we're going to only do that together and only by putting facts over fear.
Let me just say this real quick. I'm just going to give out some information here. I don't want to bombard the folks with it, but I want to make sure that they get this here. So as Senator Parker said, that 24/7 coronavirus hotline is 888-364-3065. Again, 888-364-3065. For the latest updates on how the city is responding to the coronavirus crisis, you can text COVID to 692-692. That's COVID, COVID, without the 19, COVID to 692-692. And as you know, a lot of folks are dealing with anxiety, stress related issues. People have lost their jobs. They don't know how they're going to pay their bills. And if you are considering any type of harm to yourself or to anyone else, or you just feel that you need to talk with someone, you can call the National Suicide Prevention Line at 800-273-8255. 800-273-8255. And for those folks that are at the risk or experiencing domestic violence, you can call Safe Horizons hotline, which is 800-621-HOPE. 800-621-HOPE. And before we go off, I'll make sure that we get out a couple of the New Jersey numbers also. All right.
If I could real quick, If I could, real quick, brother, just in New York, we have an emotional support line that I want
Yes.
people to know is out there.
Yes.
And so if you're in the state of New York, you can call 844-863-9314. Again, that's 844-863-9314. And Tish James, our Attorney General, has set up a hotline for people dealing with price gouging, because that's a big thing in our community now, where they're selling bleach for $12 and a bottle of Lysol for $20 and all kind of nonsense. If you're experiencing price gouging, reach out to our Attorney General, Letitia James, and the hotline there is 800-771-7755. Again, it's 800-771-7765.
Is there a number? Is there a number out there, Senator Parker? What we've done last week, we brought on a young lady, Lynette Calfani-Cox, on the stream. We had her on the Open Line show this morning. We did about an hour of calls dealing with the questions surrounding the stimulus package and any other questions dealing with finance. But is there a hotline number for folks that want certain questions in a sense about the money, how to find out about their money, dealing with mortgages, dealing with paying their rent? Is there a hotline out there? Because what we have done on these shows is try to provide someone to give out that information. Right. But I think there needs to be something a little bit more general for the public to be able to call or log on to see if they can get their answers, because a lot of folks have a lot of questions out there.
Yeah, there isn't. And let me speak to Yvette Clark and Hakeem Jeffries and Gregory Meeks and figure out whether we can do something on the federal piece to get a hotline up and going. Because I think that's a great idea, because there are a lot of questions.
All right, I'm going to check back with you and them for Wednesday, because we're going to do a show Wednesday night, and hopefully we'll have some more information for folks out there, because this is very important.
Fatiyn, just very quickly for Senator Parker, not to get into the minutiae of the state budget, but Larry did talk about the some of the cuts.
Right.
Obviously, this pandemic, unforeseen, is going to put a strain on the state budget. Governor Cuomo already said this, the state is broke. But what areas specifically do you think may be hard hit? And how does the state plan on compensating for that?
Well, the first thing is that, we really believe that none of the states are going to make it. Like, this is not a New York situation about being broke and because of Corona. The entire country is dealing with the same thing. And so we're hoping that our federal leaders, our congressional leaders, are going to do another stimulus package that is some general money for states. And we hope to get bailed out. We bail out companies all the time, but we really need to bail out the people of each one of the states. Every place when you talk about where's going to get hit, every place is going to get hit. I mean, in the budget we just did now, we have led the country in the state of New York in terms of the amount of money we put in education per pupil. And so, this year education dollars are flat. And when you put in flat funding, you're essentially doing a virtual cut because of inflation. Although this year that may not be the case because inflation may be down. But, education is flat, housing money is flat at a time when, you need more services for supportive housing, people with mental illness. I mean, one thing we haven't talked about a lot, we have a lot of people in our community dealing with mental health issues, a lot of people dealing with alcohol and drug dependency issues. Those folks can't go to their meetings, right? And so how do we provide a network for those folks during this time? A lot of folks are struggling with access to high-speed broadband. So what do you do when you have kids and you need to do distance learning and don't have, access? That's a new digital divide. And as the chair of the Energy and Telecommunications Committee, that's been one of the things I've been trying to address during this period. And so, I don't think that we're going to see a area of life that's not going to be impacted, frankly, based on not just COVID, decimating our budgets, but just generally the lack of economic activity. And it's probably going to take us, 2 years at best just to start climbing back into a strong, economic position.
So
I just want to agree.
Context to that, right? So, right now, economic projections are showing the United States that about 29 to 30% of the economy is just gone right now, right? From a GDP stand,
Man.
that's billions and billions of dollars. And it's just gonna go work, it's just gonna continue to go in the opposite direction every week. You know, and so when they do modeling, right? So much of economics is about modeling and things. There's not a lot of precedent to look back on. So when they go back and they look at the Spanish flu, and again, we weren't as global an economy as we were back then, but a couple of things will pull through, right? So it is safe to say that the economy will come back. No one knows when. But the problem is the damage that it will do to certain subsegments is horrible, right? So, you know, if you already had a gap in the poverty line before this just makes it bigger. And you never get a chance to climb out of that unless something specific is done for that segment. And that was not the case in the Spanish flu, right? They saw that gap just got even worse. And then remember what happened a few years after the Spanish flu. You had the Great Depression. And so you already had people who were impoverished before the Spanish flu, got worse during the Spanish flu, and then they got a little recovery and then fell back even further during the Great Depression. So when you look what we had here, we had H1N1. Not to the same degree as the COVID, but it did impact the economy and individuals and their livelihood. Then we had the Great Recession that people are still trying to dig their way out of. Now you have this on top of it. So unless there are economic programs, and as you said, Senator, you know, education, right? We continue to nickel and dime our education. And if you don't have that in terms of investing, so I don't think of it in terms of bailouts, even though that's what people call it. You need to reinvest in those areas to actually help you grow and get some strength in there. And this is just shining a bright light on the flaws, as you said before, Larry, around healthcare, right? You know, for Cuomo going into this to say, well, I'm cutting Medicare because we have too much hospital capacity and we got so much unused space that we're using. He looked at it from a dollar and cents and not from a broader perspective out there. So it's going to cause a relook at a lot of the decisions that we have moving forward about the economy, about healthcare, and just so many other things. And hopefully this is, you know, and we said this years ago when Trump was first elected, that, you know, there comes a point in time when you have to hit the reset button. And not to get very biblical, but, you know, with Noah and the ark, right, that was a major resetting. And I believe we're at that point right now where there is a major resetting of what's really important in the world. And you see so many bad behaviors and terrible judgments that's taking place that you hope that there's some good that comes out from it that will sustain itself, not be temporary, but from a sustainable style.
I agree with you, Bobby, and I agree with the senator, and I definitely think that we need a fourth relief package. The last relief package had some things in it for working people, but fundamentally, it was a bailout for the corporations and the banks once again. Senator Sanders and others, even before that bill was signed, was saying that we needed a fourth package. We need a fourth package that will give people a UBI during the course of this crisis. A one-time $1,200 a month payment is not going to do it. People should get $2,000 a month for the duration of this crisis. They should have, you know, in this last bill, the $2 trillion one, the manna from heaven that everybody was talking about, they pay for the COVID tests, but they don't pay for the medical care that you would need if you test positive. You know, we need people, forget Medicare for all just for a second. During the course of this crisis, we need people's medical bills paid for, period. We need a freeze on mortgages and a freeze on rents. No foreclosures, no evictions during the course of this crisis. All those workers that are out there putting themselves on the line, they need paid sick leave. They need hazard pay. Yesterday, I had a town hall meeting, a virtual town hall meeting. some people from one of the municipalities, suburban municipalities, called me and said, Mr. Hamm, we got to lay off our fire department and our police force. We need money in this next bill, as the senator said. We need money for states and municipalities so they can maintain the basic services that they are required to give by law, such as police protection and the fire department. And we need hazard pay for those frontline workers. This fourth relief package needs to be a bailout for the people. And Bobby, I agree with you. This is an unprecedented moment in human history. We were talking about this before the show started, but suffice it to say that we're at a point now, like, for instance, why do we have sanctions against other countries right now and they can't get medical supplies? Right. They can't get the medicine they need for this COVID crisis. And the Spanish flu didn't start in Spain. It started in the United States, and they put the Spanish name on it. We're at a point in human history now when borders don't mean what they meant 50 years ago and 100 years ago. Cuba right now has an interferon, a viral medicine, a viral treatment. I think it's called interferon alpha B. We can't even get that in the US because we have sanctions against Cuba. It's crazy. It's madness. We should drop these sanctions so that everybody can get the medical aid they need to fight this pandemic. Because if you fight it in one place, is not enough. You got to fight it all around the world. So we're definitely at a different stage of human development.
Larry, you said that. I just want to, Jamie, let me just piggyback off what Bobby and Larry just said, and about stimulating the economy. I agree with you when you talk about the mortgages, you talk about the rent, because like you said, Bobby, when we come back from this crisis, and I pray we do come back from this crisis well enough, that we can build on with our economy. Because if you go back to when we had to get when the federal government bailed out the banks, when they gave the banks that money, those banks held tight onto that money. And the only way that we are going to be able to stimulate this.
That's not true, but go ahead. That's not a true statement, but go ahead.
That's not a true statement that it became hard. It became harder for some folks to get loans going forward.
But what I'm saying is, when the banks were given the money,
right,
would inject liquidity into the economy, and the banks had to pay interest on it, and every one of the banks paid interest on it, and the U.S. government made billions of dollars on top of that.
But they shut out the people, though.
Oh, so what banks did at that point, though, was they tightened their credit so that they wouldn't have these kind of exposures before. But it's not like they held on to the money. The companies that held on to the money were the car manufacturers and others. Those are the ones that held on to the money because they were not injecting capital into it. So the only reason the banks got money was to inject liquidity into it, which they did, and they had to pay interest on it.
Okay.
That's all.
Okay, so talking about stimulating the economy, if we do some of these provisions as you mentioned and Larry mentioned, that is a way to build equity and look towards the future in a sense of stimulating this economy coming back. That's number one. Number two, right now.
One thing on that one, right? So just to talk about banks, right? So one of the most confusing things that happened, like on Friday, right? So part of this package was supposed to have small businesses get loans from the banks.
Right.
They were very loud and complained and said, I want to, again, be the vehicle to inject capital into it. Great. But the federal government came up with no clear guidelines for banks to do that. So Friday, there were many small business owners who Thursday night had prepared to get up early, to go online, to get stuff, and then they were disappointed because the bank said, hey, I want to give it to you, but the federal government has not given us clear directions as to how this is supposed to work. So we'll keep putting pressure on them. And Marco Rubio came out with one of the most asinine statements as he talked about, well, they know how to do this. No, they know how to do it with their money. They'd have to do this differently with the federal government's money. And the federal government, to the earlier point, does not have the right staff in place. They've undercut the support that they need to try to do things as big as this is and as quick as this is. They have undercut the IRS, they have undercut the Treasury, they have undercut Small Business Association. So there's not enough competent people to put forth a plan for billions and billions of dollars to get injected into the country.
And Senator Schumer was on Reverend Sharpton's show Friday, and he basically said what you just said, Bobby. And he said that come Monday, the federal government will get this information out to these banks. So hopefully this week, and we'll do an update, hopefully Wednesday night, to update the folks to see how this is going. So that's definitely on the radar. But I just want to make this case because I know Jamie wants to jump in here. I just want to make the point about the voting. With this pandemic, this has intensified the Democrats' push to vote by mail. And of course, the Republicans don't want to do this. You know that a lot of the state primaries that were scheduled have been pushed back. The question is, as we talk about the White House, this Trump administration, and we need to get them out the White House, the question is as this pandemic continues, will we have an election, a presidential election, come November?
I want to go back, though, to what Bobby was saying earlier, and Bobby's absolutely right. The architecture and infrastructure is not in place, and that was the concern from the very beginning with the stimulus package, particularly with the money going to the banks. And Bobby, you're right. The banks are not even really getting clear directives of how, to move forward. And so that was one of the biggest concerns. Is the infrastructure and architecture in place to do this? And as Bobby pointed out, because you have so many positions, key positions in administration that have remained unfulfilled since Trump assumed office, now we see the byproduct and the effects of not filling those very critical positions.
Or he's putting people like the TV guy from CNBC, Larry Kudlow, in charge of things. He's putting in the
pillow guy.
Right,
pillow.
He's putting a My Pillow guy in there. So where he doesn't have competence and he's replaced it with incompetence, there's no surprise that the government can't work.
Right. Now, what about the whole thing with the election, the presidential election, where we had it? We also got the Democratic convention moved in July. They moved that, I believe, to August right now as a date.
Yeah. So one of the things that we have to all really understand is that this is a life-altering event, right? That, one of the things that we're going to need to think about is what does society look like? What does every single function that we do in society look like? And how is it going to be different post-corona, right? And post-COVID, right? And so elections are a big part of that. We had an election, a special election that was supposed to happen in Queens on March 29th. We were in the middle of petitioning when this thing hit. One of the things the state legislature did immediately was end the petitioning process and change the rules around petitioning. We pushed back that March 29th special election. We have now moved the April presidential primary. And right now we have a June primary, and I think we're going to push everything back into June. And we're looking at vote by mail. Now, as it relates to elections are state functions and not federal functions. Right. So even when you look at the presidential election, it's not one national election, it's 50 state elections.
Correct.
And so those rules are going to need to be handled on the state level. They could be handled on the federal level, but they're primarily going to be handled on the state level. And all of us are looking at that. We expect that we will be, quote unquote, back to normal by November. And so no one is actually looking at not being able to have elections in the way that we've traditionally had them. However, we are also looking at having a stronger vote by mail operation in place by that point. And I think many other states are looking at those same kind of provisions. And
Senator
so,
Parker, one of the concerns.
I think that's an advance, frankly, for voting. I think if people can vote from home, that's going to be an easier way for people to vote.
But Senator Parker, you just said something that troubles me. And what troubles me is you said by November, post Corona. See, the bottom line, no one expected this. But the question is, are we planning for the next 6 to 8 months? And what I mean is, if we start planning post-corona, we don't know if we will be post-corona in November. So what is the plan going forward in the sense of an emergency plan by our government?
Vote by mail. Vote by mail is
no, I'm not just talking about voting. I'm just talking about in general.
Oh, I mean,
in general, right now, we may not even be ready to vote because this thing may be worse than what we think it will be in the next 3 to 6 months.
There are no, let me just say this, okay? Because we talked earlier about listening to the doctors. There is no epidemiological model that has this going out 9 months, right? I mean, most of the models, even the worst case scenario models, you look at the Gates scenario, which is what Bill Gates did, and the Bill Gates Foundation did, and what they're looking at. Their model is another, I think, 4 or 5 months at worst. That's like the worst case scenario, right? So by November, we expect to be in a place where social distancing is probably relaxed almost 100% around the country. And so, things can be changed. I agree with you that there needs to be some conversations about what happens post. But to be honest with you, there's some of those conversations happening, at least on the governmental legislative side. But the reality is that in the state of New York, who's ahead of every place else, we haven't even hit our peak yet. We're talking about another 7 to 14 days before we hit our peak. And so we're really still kind of in this moment, trying to navigate this moment before we start getting ahead of ourselves. But on the narrow notion of voting, I expect that vote by mail will be a strong part of it. We have a really good brother out of Brooklyn, Senator Zono Amiri, who is the chair of the Elections Committee, an attorney, super duper smart, really understands this stuff in a way that most people don't. And I trust him and people like Lyra Comrie and Assemblywoman Walker. I don't know why, Latrice Walker. I don't know why Latrice, I'm sorry. But Assemblywoman Latrice Walker.
Get you.
Yeah. Who think about this stuff all of the time, who will have us prepared, at least on the election side. But I think we're a month or two away before we start getting post-corona plans and talking about what the world looks like at that place.
Dr. Fauci said this curve may not curve down until there is some type of vaccine, that it could be 18 months away.
Exactly. Hey, Fatiyn, let me make this point going back to the voting. We have to remember, so many of the state legislatures in key swing states, and we're looking at the national election, is controlled by Republicans. They're going to be in lockstep with Trump. Just yesterday, he said he feels that people should not be voting by mail or voting online. He said, hey, I feel that people should come physically into booths with their ID, and that should be the only way they should be allowed to vote. So he's already setting the stage for voter suppression. He's already setting the stage the national elections by controlling what a lot of these, by sending out the dog whistles, by how these states and the state legislatures are handling voting in November. And again, many of those state legislators in these key swing states are controlled by Republicans.
The more revealing statement was, in terms of Trump, that he said vote by mail would hurt Republicans.
He said that.
I mean, that was such an open admission of what they've been doing for the past 10 years. I mean, that the president would say that something that could extend democracy to the nation, in fact, will hurt Republicans. So
remember,
that's why we're against it.
Yeah, remember his big thing was, he won. He didn't win the popular vote. He won, the
Electoral College.
Electoral one, right? And so if you suppress numbers of people, and and there's Senator, you talked about conspiracy. One of the conspiracies going on right now is he's holding on to PPEs and ventilators to give to more of the red states when they get their surge, and I'll do minor things for California and New York out there. But if he comes and he can keep the surge down in the red states, and you don't have people, voting by mail, and the only people who can come out are those in the red states, then he gets a chance to get reelected, not just with the electoral, but also from the popular, because there's less people in the bigger blue states who are just not going out to vote.
This, there is a conspiracy, speaking of conspiracies, the Republican Party, the last 3 elections that the Republican Party won for president, they stole those elections. Those elections were stolen. The Republican Party cannot win a popular presidential election based on mass participation and voting. And this is a very dangerous period that we're in. One thing people in power do, they take advantage of crises. They use crises to extend their power. And this is holding true for the Trump administration. We have to keep our eyes on Trump. Already, the Justice Department has asked for expanded powers to arrest people without reason, to detain them indefinitely, which is in violation of the writ of habeas corpus in our Constitution. It's a violation of one of our basic fundamental rights. I wouldn't be surprised if the Trump administration tries to play some games with this upcoming election. Now, the election is set by the Constitution. It would take an act of Congress, literally. The Constitution would have to be amended in order for a presidential election to be canceled. But you can be sure that if there's a way to move around certain things, the Trump administration is going to try to do it.
Well, Bill Barr is already attacking habeas corpus, and that's been evident. And I mean, it's been pretty well documented.
Yep. Lynn Chula Rodriguez writes, no vote by mail. Remember when Jeb Bush from Florida dumped all the Democratic ballots in an alley dumpster so his brother could win a second term?
Wow.
So, that's something that a lot of folks don't feel. And can they do this? Can they put the infrastructure in place in time for the national election?
It's already in place. They already have it in place. How many elections have they stolen? And they steal them at the state level. We do not have a federal government system of elections. You just said it. We have a state-by-state system. Each state has its own set of laws and operates within those laws. And all of these red states, and even sometime the blue states, use these situations to suppress Black people's votes.
Yeah, I should have said, is there infrastructure in place to protect our voting rights by voting by mail? That's what I should have said.
No, you know why? Because we need a constitutional amendment to guarantee the right to vote. The right to vote is not guaranteed in the Constitution of the United States. And one of the things we must have, even before abolishing the Electoral College, because that's a heavier lift that we have to do, but we need a constitutional amendment that guarantees every citizen's right to vote.
And I think we need to go back to the gubernatorial election in Georgia and see what happened to Stacey Abrams, and we now have Kemp as governor. That is a prime example, and trust me, governors like Kemp and DeSantis and others will do that and continue to do that because, as Bobby said, they're trying to not only suppress the popular vote is what they're trying to suppress. Now, Trump won the Electoral College, we know that. But again, as Bobby said, they're looking to suppress and win the popular vote. And this is a manner in which they're going to do that.
So just remember what happened once when he was first elected, Trump was first elected, he tried to put in place all these oversight committees and on a federal level to sort of try to review, because he was claiming there was so much fraud in the election, and he was trying to invade all the different states and have the states share their information back up to this watch group that many of the states had fought in the court systems and say, no, we're not doing that, not doing that. And then eventually he relented and had that commission fall apart. So you're right. He knows that there's, you know, the elections take place at the state level, and he's trying to figure out, if I can't get my governors in those states to help in the fix, then for those who I don't have in the fix, what can I do at a federal level to try to suppress that out there? So it's just sad that as people are losing their lives, this is going on in the background about voting.
Wow, this is interesting. Hey, Senator Parker, just to go back to our healthcare system right now, just looking at New York City right now, and as a lot of folks have said that the wave is going to go across the country, but let's deal with New York, that Mayor de Blasio and Governor Cuomo have asked across the country for healthcare workers to come and assist and help and aid. They've asked folks that are retired to come out of retirement. But we also having the front line, those that are on the front line, that are your everyday workers that are in the hospitals, have been in the hospitals, that are getting sick. Some are recovering, some are not. Who is going to be running? Who's going to be in charge when you have, let's just say, a lot of folks that are not a part of New York hospital system, and you have a lot of the folks that run the system that are down? What is in place to make sure that this runs smoothly?
Well, you know, what the governor has done is reimagine the model here in the state of New York. And one of the first things he said, you know, a couple of weeks ago was that they've had to break away from what used to happen, which was you had city hospitals, you had private hospitals, they're, you know, working in their own little silos and their little fiefdoms. And he essentially says, you know, we have right now, he's in the beginning of kind of breaking that system and rebuilding it into one statewide system. And so in the same way that he's talked about the notion of using resources from around the country and sending it where it is needed, he's done the same thing around the state of New York, which has not been easy. Getting, you know, folks from Haney's and the Greater New York Hospital Association to agree to work together. And so what he's done is gotten resources from upstate hospitals and brought them down into New York City, Nassau, Suffolk. Right now, like, you know, the vast majority of the infestation in New York has really been in 9 counties. New York City, the 5 counties in New York City, Nassau, Suffolk, Westchester, and Rockland, right? It like really accounts for about, you know, 80 or 90% of all of the cases in the entire state. And so in other places, he's saying, give us your masks, give us your ventilators. If you have a problem, we'll send them back. But right now, same thing he's saying nationally, he's done in the state level. And so, you know, I'm not really, you know, in terms of running the hospitals, the people who run the hospitals, you know, are not dealing with patients. So the notion of running the system is not the issue. The problem is more on the ground. Are you going to have enough nurses, enough healthcare providers, enough pulmonary technicians to actually, you know, have hands-on in terms of patients? That's the real concern. And so obviously, like we've talked in the very beginning, PPEs, N95 masks, shields, all that stuff is going to be critically important to have in order to protect our healthcare workers and keep them on the job. And that's just not and we're talking about the healthcare system, and that's obviously evident, but we're having that same problem literally in transit. I mean, they're shutting down lines because people are calling into work. And that's another problem too, is that, like, there are people in healthcare who are scared to come to work, and understandably so. When you see literally people, your colleagues, getting sick and dying right next to you, right? And so there's been an issue with people calling out, people not coming in. And so, maintaining the system and getting past this surge is the main is the main concern for us in this moment.
What I meant, Senator Parker, I just want to clear this up. Last week we had the president of Downstate Dr. Riley on.
Dr. Riley, Dr. Wayne Riley.
Yes, and he's running the hospital. What I mean is, in these emergency rooms, you have the attending doctors, and I'm talking about attending doctors who have to sign off on the final decision.
Right.
And who's going to get this ventilator? That's what I mean. When those folks that are have been working out of those hospitals, but now they are down, and now you may have replacements in. That's what I'm saying. I just want to make sure that the folks that need the right decisions to be made is that we have the right folks calling and making those decisions. That's what I'm saying.
There's enough redundancies in the system, and even with the volunteers and the people who are coming in from out of state and people who are coming back from, coming out of retirement, they're going into a clearinghouse. And the first thing that's happening with those folks, and this is being done by Jim Malatras up in Albany, is that they're checking their qualifications to make sure that their certifications and things are up to par, and checking on any disciplinary or other problems that we should know about ahead of time. So they're vetting people. And so anybody coming in to help in the hospital has been vetted. They're all credentialed, and we should have a continuity of care that looks like the regular standards that we are used to and expect from our hospital system.
We have 5 minutes left.
Senator Parker, this question. So in the procedure or the protocols, are they streamlined for those who are coming out of the state? Because you have many volunteers, doctors who are licensed in Michigan who are volunteering to come into the state to work. Has that process been streamlined and it's pretty expedient as well?
Yes, we have a great deal. I mean, you can't have too many people available in a crisis like this, but I don't feel like the state is feeling that our biggest problem is going to be availability. It's really more in deployment and getting those people where the places they need to be in a timely fashion is really the issue that we're confronting right now.
Right. Real quick, I just want to say this. Mentioned it on air. It's been mentioned this week that the 3-time Grammy Award winner, singer and songwriter Bill Withers died this week from heart complications. He passed at the age of 81. He's known from the songs "Lovely Day," "Ain't No Sunshine," and of course, "Lean on Me," where ironic now so many folks are singing that song or in a sense of leaning on one another to try to get through this tough time dealing with this coronavirus pandemic. And Larry, you opened up when in the introduction, and you mentioned, April 4th was the assassination date back in 1968 of Dr. King. Where are we, my brother? Here we go with a pandemic, and here we go again with the poor and the blacks are suffering when it comes down to healthcare, when it comes down to finance, when it comes down to jobs. How far have we come as a people since the assassination of Dr. King?
Well, as a people, we've certainly made some strides. If I was to say absolutely that we haven't made any progress, that would really not be true. Some progress has been made. For instance, since the civil rights movement and the assassination of Dr. King, there has been some expansion of the Black middle class. And that was due in large part to the destruction of the barriers of racial segregation, particularly in the areas of education, housing, and employment. So there was some expansion of the middle class. I mean, look, I went to Princeton University. My father was a truck driver who passed away when I was 4 years old. My mother was a seamstress who worked in the cleaners around the corner. I don't think my mother made more than $3,000 in a year, but I was able to go to Princeton University. How did that happen? Because I was a genius? No, it happened because there was a civil rights movement that kicked the doors of all of these universities open so that poor students like myself and Black students like myself could come to these universities, get degrees, and then work in jobs that our parents couldn't work in and have incomes that our parents couldn't imagine, and then use those incomes to buy housing and houses in neighborhoods where we couldn't live either because we couldn't afford to or because redlining prevented us from being able to buy homes and rent apartments in those areas. So some progress has been made. But for the vast majority of Black people, the masses of Black people, we are basically socioeconomically in the same shape we were in 1968. The fundamental paradigm of Black superordination, of white superordination and Black subordination is still in place. The majority of Black people are still poor. We still suffer from racism, racial discrimination, racial violence, racial oppression. You know, so Dr. King's fight is not over. And people walk around and say, well, we've come to the civil rights promised land, or the fight is over. They're really being disingenuous and dishonest. I mean, we have to fight as hard today as we did in 1968. If there's one thing the civil rights movement taught us, is that when we unite around a common program and we build a mass movement around that program, that's when we make progress. And that's what we're really lacking today. We're lacking that kind of mass movement and mass mobilization that Black people had in the 60s. And we really need to get it back. And I just want to end by saying this, that we have a King holiday, we have a King monument, but I challenge anyone to tell me what public school in the New York metropolitan area requires one of Dr. King's 6 books to be read by its students. They're not. Dr. King wrote 6 books. And I'm gonna tell you real quick what the 6 books were. Measure of a Man.
Correct.
Stride Toward Freedom. Strength to Love. Why We Can't Wait. Where Do We Go From Here? Chaos or Community. And Trumpet of Conscience. Every parent needs to go into their school and say, what writings of Dr. King is on the required reading list, is in the lesson plan of any teacher in this particular school. Because if we just let Dr. King's birthday be another sale day, then we have failed.
Right. Dr. Reverend Sharpton on his national syndicated radio show has been on a daily basis recommending books for folks and asking folks to call in to recommend books while folks are staying in, to take the opportunity to self-reflect and self-build and to do things that they haven't done to make themselves better. And one of those things is read. And I recommend those folks to pick up one of those 6 books of Dr. King. A lot of folks don't even know that Dr. King has written 6 books. I also want to pass off.
Let me mention something else real quick. This week also marked the birthday and the death of Marvin Gaye.
That is correct.
And Marvin Gaye's What's Going On album is probably one of the greatest albums of social justice music that was ever composed. I mean, when I listen to Inner City Blues by Marvin Gaye, it sounds like he's talking about right now. And the other person whose anniversary passing marked this week is Brother Gil Scott-Heron, one of the most underrated, great poets and artists of our time. Even though he didn't get the recognition that others got, I'm telling you, I wouldn't have gotten through college if I wasn't able to listen to and be inspired by the music of Gil Scott-Heron.
And one thing that Bob Slade would say is that Marvin Gaye was robbed of a Grammy for that What's Going On album. I believe Lou Rawls was given the Grammy that year for that.
Wow.
And I've never forgotten that. That was one of the Soul Beginnings shows that I worked on with Bob Slade. And God bless Bob Slade. So also I want to mention and thank one of our viewers for reminding me, I forgot to mention this on the morning show, is that we lost another artist. When I was DJing, I definitely played bounce, rock, skate, roll. And I'm talking about Vaughn Mason, who died this week at the age of 69 years old. And he died from complications of the coronavirus. So condolences to his family. There's so many people that when I wake up in the morning and look at social media, it's another person that has died. So like we said, condolences to all those folks out there. We take that moment to say that we are sorry for your loss. And we are just trying to hold on to trying to get by this here together. and follow those instructions of staying home, washing your hands, and doing what needs to be done to slow this curve down.
Can I just make this one comment? We talk about Dr. King.
You got to wrap up in 30 seconds.
I do think this pandemic, and I hope that it creates a mass mobilization around the healthcare system in this country.
And Brother Fatiyn, as we close, let's not forget that the census is happening. It's 10 questions, 10 minutes. It's going to impact our lives for 10 years. You can do it online at www.uscensus.gov. That's www.uscensus.gov, or you can do it on the phone at 1-844-330-2020. Again, that's 844-330-2020. Fill out your U.S. Census. Please get counted.
Yes, thank you, Senator Kevin Parker out of the borough of Brooklyn. I want to thank you for joining us this morning. I want to thank you're welcome, my brother. I want to thank our team, Brother Jaime Harris, Bobby Childs, and of course, Brother Larry Hamm. And as I stated, Adam Clayton Powell passed April 4th. I believe in the year. I don't have the year in here. I don't want to put the wrong year. Was it 1972, Larry?
Yes.
Well, I believe, yes, 1972.
Yes.
And, this is a brother that brought hearings to Harlem. And he wrote so much legislation. He's put some of the congressional leaders today to shame of what some of the things that the great leader and minister of Abyssinian Baptist Church, who allowed Malcolm X to speak in that pulpit in Abyssinian Baptist Church. So just want to also mention him. So this wraps up this week. I just want to mention that we have a special edition of the Openline-Online stream this coming Wednesday night at 8 p.m. We will be live again on Facebook. Just go to Facebook and type in WBLS 1075 NYC. We'll be on for an hour. We will not make these guys work an hour and a half to 2 hours like we normally do. We want to thank our production team, Brother JB, and the whole digital team and staff. And I'll leave Bobby Childs with the final words of today's show.
All right, so as always, I want to thank everybody for tuning in. We are so grateful to our production staff for being able to allow us to still share the truth with you. As our senator has said, we try to give you an honest view of what's going on. Also want to say rest in peace to Ellis Marcellus, the patriarch of the Marcellus family, who passed away at 85.
Yes.
And as Fatiyn said, our prayers go out to all of you who may have friends, family, and those close to you who are sick with the COVID-19, and condolences to those of you who have lost family members and friends who died as a result of it. As you know, this is one of those things that touches a generation. So from mental illness to physical health, and actually those who passed away being wage earners for their family is another challenge that's out there. So this is those generational impacts. So as we always say, get your mind right by being as informed as many different venues as possible, and keep a good thought. Thanks for tuning in, everybody.
All right, take care. Goodbye. Peace, everybody.